Methamphetamine. Methamphetamine is a powerful stimulant, a chemical that floods your brain with dopamine and adrenaline, supercharging everything at once. It's often taken by smoking, swallowing, snorting, or injection, and within seconds, it hits like a lightning bolt. As the onset begins, energy explodes. Your heart races, your mind sharpens, and every sense turns up to maximum volume. You feel awake, unstoppable, invincible. Talk becomes fast, thoughts move quicker than words, and sleep feels completely optional. At the peak, the rush is pure intensity. Confidence turns into euphoria. Motivation becomes obsession. You might clean your whole house, talk for hours, or chase a goal that suddenly feels like destiny. It feels like control, but your brain's just burning through its entire dopamine supply in one go. Then comes the come down, and it's harsh. Energy vanishes. The mind crashes into exhaustion, depression, and paranoia. The world feels gray, slow, and empty, a chemical hangover that can last for days. Meth is extremely addictive. Each high rewires your brain to crave that rush again, while destroying the system that creates pleasure naturally. Over time, it leads to severe weight loss, insomnia, hallucinations, and memory loss. Meth gives you energy that feels infinite, until you realize it's stolen from your future self. Cannabis. Cannabis is a psychoactive drug made from the marijuana plant. It's most often smoked, vaped, or eaten as an edible. The main active chemical is THC, which interacts with the brain's endocannabinoid system, the network that regulates mood, memory, and perception. When THC enters the bloodstream, it rushes to the brain and binds to receptors that normally handle natural chemicals called anandamides, molecules that help you feel relaxed and balanced. That's when the onset hits. Time slows down, your senses sharpen, and everything feels slightly funnier, warmer, softer. At its peak, cannabis can heighten creativity and calm, or tip into confusion and paranoia depending on the dose and mindset. Music sounds deeper, colors feel stronger, and ideas seem profound. It's a distortion of normal reality that feels both dreamy and focused at once. As the come down begins, thought slows, speech drifts, and tiredness sets in. For some, it's gentle. For others, it's heavy, an invisible fog that lingers into the next morning. Cannabis is mildly addictive, but mostly psychologically. Regular use can dull motivation, mess with short-term memory, and in heavy doses, trigger anxiety or panic. It's often called harmless, but it quietly reshapes how your brain rewards relaxation. Cocaine. Cocaine is a powerful stimulant made from coca leaves. It's most commonly snorted as a white powder, but can also be smoked or injected. Once it enters the bloodstream, it floods the brain with dopamine, blocking your body from reabsorbing it. Suddenly, your brain is drowning in pleasure signals. The onset is almost instant, a rush of euphoria, energy, and confidence. Your heart pounds, your pupils widen, and your brain feels electric. Every thought feels brilliant. Every move feels perfect. You feel untouchable. At the peak, you're fast, focused, and alive. But the brain's reward system is already burning through its fuel. The high is sharp and short. Within minutes, dopamine levels crash, and the come-down slams in. Anxiety rises, mood drops, and exhaustion hits. You crave more just to feel normal again. Cocaine is highly addictive. The brain quickly learns to link it with pleasure, motivation, and control. But it's an illusion. Each hit rewires you to need another. Over time, it damages the heart, constricts blood vessels, and rewires brain chemistry so deeply that joy without it feels impossible. Nitrous oxide, laughing gas balloons. Nitrous oxide is laughing gas, the same chemical dentists use to keep patients calm during procedures. Recreationally, people inhale it from whipped cream canisters or balloons at parties and festivals. It feels harmless because it's legal, medical, and the high lasts only 30 seconds. But those 30 seconds cut off oxygen to your brain. When you inhale nitrous oxide, it floods your lungs and enters your bloodstream, traveling instantly to your brain. There, it blocks NMDA receptors, the same ones affected by ketamine and alcohol. The onset hits within seconds. Sound becomes muffled and distorted, like you're underwater. Your body feels weightless, detached, and a wave of euphoria rushes through you. Everything seems hilarious, profound, or both at once. At the peak, reality bends. Your sense of self dissolves briefly. Some people describe a ringing sensation, a feeling of being pulled backward, or the sense, strange, that they've understood something important about existence. Then it ends as fast as it started. Within a minute, the world snaps back. You're left slightly dizzy, disoriented, and craving another hit immediately. That's the trap. Because the high is so short, people inhale repeatedly, sometimes dozens of times in one session. Each time, your brain is starved of oxygen. Do it often enough, and nitrous oxide depletes vitamin B12, which your nerves need to function. Long-term users develop numbness, difficulty walking, and permanent nerve damage. DXM. DXM, or more commonly known as robotripping, is dextromethorphan, the active ingredient in over-the-counter cough syrup. At normal doses, it suppresses coughs. At high doses, it becomes a dissociative hallucinogen that separates your mind from your body. People drink entire bottles of syrup, swallow handfuls of gel caps, or extract the powder. The experience is called robotripping because your movements become stiff and mechanical. Once consumed, DXM converts in your liver into DXO, which blocks NMDA receptors in your brain, the same receptors affected by ketamine and PCP. The onset creeps in slowly over an hour. Your body feels heavy, distant, like you're piloting it remotely. Nausea hits hard at first, a side effect of chugging syrup meant for teaspoons. At lower doses, the peak feels dreamy and floaty. Music sounds richer, thoughts drift, and reality softens around the edges. But at higher doses, the experience shifts into full dissociation. You might see closed-eye visuals, feel like you're watching yourself from across the room, or lose track of where your body ends and space begins. Time stretches. Your bathroom mirror becomes a portal. Coordination vanishes completely. As the come-down starts, grogginess takes over. Your thoughts move like sludge, speech slurs, and a chemical hangover lingers for hours or even days. DXM builds tolerance rapidly, meaning each trip requires more to reach the same level. Heavy use causes memory problems, liver damage, and a condition called Olney's lesions, where parts of your brain physically deteriorate. 2CB. 2CB is a synthetic psychedelic created in a lab during the 1970s. It sits somewhere between MDMA and LSD, offering both visual hallucinations and emotional warmth. People take it as powder or pills at raves, festivals, and clubs because the experience feels more controllable than a full acid trip. Once swallowed, 2CB binds to serotonin receptors in your brain, particularly that states that shape perception and mood. The onset begins within 30 to 45 minutes, often with nausea that fades as the drug takes hold. Colors start to intensify, patterns begin to breathe, and your body feels electric and sensitive to touch. At the peak, visuals bloom without overwhelming you. Surfaces ripple, light trails behind moving objects, and everything pulses with energy. Music feels physical, like you can see sound waves moving through the air. Emotionally, you feel open and connected, but clearer than on MDMA. You can still think, hold conversations, and stay grounded in reality, even while it shifts around you. The experience lasts 4 to 6 hours, shorter than LSD. As the come-down arrives, visuals fade gradually, and your thoughts return to normal. Some people feel energized afterward, others exhausted. There's no harsh crash, just a slow descent back to baseline. 2CB can trigger anxiety or paranoia at higher doses, and like all psychedelics, set and setting determine whether the trip feels magical or terrifying. Physically, it's relatively safe, but the powder is easy to overdose because active doses are measured in milligrams. A few extra milligrams can turn a pleasant trip into hours of overwhelming chaos. LSD. LSD is a hallucinogen, a mind-bending chemical that completely rewires how your brain processes reality. It's usually taken on tiny papers placed on the tongue, and the amount you ingest is microscopic, measured in millionths of a gram. Once it hits, LSD binds to serotonin receptors, particularly one called 5-HT2A, which helps shape perception and mood. That's when the onset begins. Patterns start moving, colors shift, sounds seem to glow. It's not like seeing hallucinations appear, it's like reality itself starts breathing. At the peak, which can last for hours, time loses meaning. Your sense of self, the part of your brain that says, "I'm me," dissolves. You might feel connected to the universe, euphoric, terrified, or both. Emotions become physical. Music feels alive. The boundaries between thoughts and sensations blur until everything feels like one continuous wave. Then comes the come down. Slow, gentle, like returning from orbit. Reality rebuilds itself piece by piece. You might feel calm, reflective, or emotionally drained. Some people describe it as a reset, others as being rewired. LSD isn't physically addictive, but it's unpredictable. The same dose can be bliss or nightmare, depending on your mindset and environment. It can also trigger flashbacks or anxiety long after the trip is over. LSD opens the mind, but it doesn't always close the door cleanly behind it. Ketamine. Ketamine is a dissociative anesthetic, originally designed for surgery. It's used medically today in small doses to treat depression, but recreationally, it's taken for its out-of-body effects. It's snorted as a powder or injected in liquid form. When it enters your system, ketamine blocks a chemical messenger called glutamate, which helps your brain process sensory input and maintain awareness. The onset comes fast. Within minutes, the world starts to feel distant, muffled, almost dreamlike. At the peak, perception detaches completely. You might feel like you're floating above your body, or watching your life from a distance, what users call the K-hole. Time stops making sense. You might see yourself from the outside, or feel like you've left your body entirely. It's not always pleasant. For some, it's peaceful. For others, terrifying. As the come down begins, awareness slowly returns. Vision clears, speech reconnects, but the world still feels foggy. For a short while, it can leave you strangely calm, like your thoughts are moving underwater. Ketamine isn't classically addictive, but it builds tolerance fast. Heavy use can cause memory problems, bladder damage, and emotional numbness. It can disconnect you from pain, but also from meaning. It's a drug that separates body from mind, and sometimes they don't fully meet again. Opioids. Opioids are painkillers that come from the opium poppy, or are made synthetically in labs. They're used medically as morphine or oxycodone, but on the street, they show up as heroin or fentanyl. They're swallowed, smoked, snorted, or injected, and all work the same way. They attach to opioid receptors in your brain and body, blocking pain and flooding you with euphoria. The onset brings warmth, comfort, and relief. A deep, heavy calm that feels like safety itself. Pain fades, stress disappears, and your body melts. It's not an energetic high. It's like sinking into the world's softest blanket. At the peak, everything slows. Breathing becomes shallow, your heartbeat slows, and thoughts drift. It's bliss, but dangerously close to unconsciousness. Many users chase that feeling, but each time it's shorter, weaker, harder to reach. Then comes the come down, and it's brutal. Anxiety, muscle pain, nausea, sweating, insomnia. Every nerve in your body screams for the drug again. That's withdrawal. It doesn't just make you want more. It makes life unbearable without it. Opioids are among the most addictive substances known. They rewire the brain's survival system, teaching it that the drug is as essential as air. Over time, they destroy tolerance, organs, relationships, everything. The warmth they give in the beginning is the same warmth they take away from everything else in life.